Member from Halton.
Thank you, Mr. Speaker. To the Minister of Health. Minister, Oakville, as you will know, is one of the fastest-growing towns in Canada, and the current hospital is busting at the seams. Last June, your predecessor announced that there'd be a one-year delay on the construction of the new hospital. To get that important project up and running as quickly as possible, Minister, will you allow the request for qualification of builders to go forward?
Good question. Sir.
Speaker, I know very well that Infrastructure Ontario is working with the hospital in Oakville, with Trafalgar Memorial, to get this project on track as quickly as we possibly can. It's with tremendous regret that there was any delay, and it was simply because we have put so much work onto the market that there is a need to match up the capacity to be able to deliver the project with the ability and all that's out there. Speaker, I know that the folks at Infrastructure Ontario are working with John Oliver, working with the board, working with them, and we will be moving ahead with the requests as has been laid out by Infrastructure Ontario for qualifications, later on for RFPs, and I very much look forward to working with my colleague opposite and with the member from Oakville, Kevin Flynn, to be able to get shovels in the ground and see that much-needed project delivered quickly and as quickly as we possibly can.
Supplementary.
Thank you, Minister. That should have been done a long time ago. Milton is the fastest-growing community in Canada, and has submitted a business plan for the needs of a Milton Hospital expansion to your ministry. Your ministry, last September, they submitted that. Your ministry has been sitting on them since last September, and they can't proceed with a functional design program until that approval takes place. Milton that hospital in Milton was built for a population of 30,000 people. The current population in Milton is 75,000 people, 2.5 times greater. Before the hospital can be expanded, the population of Milton will be 116,000 people being serviced by a hospital built for 30,000 people. Minister, will you approve the business plan for needs for the Milton Hospital with all possible haste?
Mr.
The member in the question says these things should have been done long ago. I couldn't agree more. But unfortunately, when that member sat on this side of the House, he did not lift a finger to get these projects moving ahead whatsoever. Regrettably, Speaker.
To ask the honourable member to listen to the answer, please.
Speaker, it took Kevin Flynn and Dalton McGuinty and the effort of this government to get over 100 hospital capital projects moving forward. And Speaker, I'm very proud of that achievement. I have, and I say to the member that I am aware of the needs, pressing needs in Milton and in other places around the province. Speaker, we are working with my colleague, the Minister of Energy and Infrastructure, as he puts together the next iteration of that capital plan. I know that he has the support of the Finance Minister for a 10-year, $60 billion infrastructure investment. I will say to the member that no decision.
Thank you.